This is Kevin Trubenbach with Transition Health Benefits team. I'm going to go over a quick 2024 buyer's guide for buying health insurance with the Affordable Care Act. So with our agency, we are here in Wisconsin, but we do represent the Affordable Care Act in multiple states. You may have an Affordable Care Act plan now. Here's the updates going into 2024. First and foremost, when you hear the word marketplace, ACA, HealthCare.gov, Obamacare plans, they all mean the same thing. Our agency works with all these different carriers at no cost to you as the consumer. We can help guide you through that process. Open enrollment starts November 1st, goes through January 15th. You can apply November 1st through December 15th. You'll get a January 1st effective date. From December 16th through January 15th, it's a February 1st effective date. Keep in mind, our agency also works with all the different Medicare type plans. Here is our team to help support all of the clients in Wisconsin and multiple other states. The Inflation Reduction Act that was signed into law by President Biden back in 22, the good news, higher income earners can now generate and qualify for a subsidy through 2025. So that is great news. The good old days, if you were a single individual and you made above $58,000 of income, you now had to pay the full price. Now individuals can make above the 400% of the federal poverty level and still qualify for a subsidy. Along with that, some of our individual or clients, they have what's known as a cost share plan. So cost share plans are specific plans that the government, hey, if you make less money, we're going to give you a better plan design. And those are three different categories. And you can see here the 100 to 150%. So if you're an individual that makes $19,000 of income, you get a special cost share plan from the marketplace. Those cost share plans can only be available in the silver category. So remember, there's bronze, silver, platinum, and gold plans that you can buy. The cost share plans are only in the silver category. If you make between 150 and 200%, then you qualify for another cost share plan, and then up to 250%. So there's basically three levels of cost share plans. If your income is lower, you qualify for these special plans, and we can help show you those different plans. Also, did you know in 2022 with the Inflation Reduction Act, you can all make the higher income. And what's also still going on, the income cap. So anybody, if you make, so the example here, if you make $100,000 a year of income, the maximum you would pay is 8.5% of your income. So the max you would pay for a marketplace plan would be $8,500 per year. So that's just something to be aware of, that anybody and everybody can qualify for a subsidy if you're in those guidelines, and you can, like I said, make higher than the 400%. So estimates are fine. So what we're doing now, starting November 1st, is estimates into 2024. You're guesstimating what amount you or your household are going to make in 2024. The amount, estimates are fine. As long as we're close, nobody is going to owe back or get back thousands of dollars. So the amount you owe or get back is usually a few dollars as long as we're close. In 2023, the average was $70 per $10,000 of income. So if you gave me an income of $40,000, but at the end of the year it was $50,000, then you would owe back approximately, you'll do this when you reconcile your taxes, but you would owe back $70 per month times 12 months, assuming you are on the plan for 12 months. As long as we're close, nobody's going to owe or get back thousands of dollars. All right? Here's the steps. So we're here as an agency to help you from start to finish. Our recommendation is to do this. And reminder, if you're on an ACA plan now, you're going to be getting a renewal in the letter or in the mail from the insurance company right around November 1st. For the majority of companies, not just in Wisconsin, but outside of Wisconsin, those renewal letters that you're getting, the health insurance renewal rate is correct, but the subsidy amount is typically last year's subsidy. So when they run the letters, the government, in their infinite wisdom, they run those subsidy letters and they're pulling the 2023 subsidy. So you want to make sure and double check what your subsidy is going to change in 2024. There's only a handful of companies in Wisconsin, that's Common Ground and Chorus, that they actually wait and send you out the correct renewal letter. Almost all the other companies in Wisconsin and other states, the renewal letter, like I said, is correct, but the subsidy amount is wrong. Every year, these subsidy amounts do change. And new rules as of June of this year, if you're working with an agent, you must get their consent to work with us. And we have that consent form on our website. When you register online meeting with us, it will prompt you to fill out our consent form. It takes all of 1 minute to review. And if you're new to our agency, you can pick any of those associates, click on their link. You can schedule online with us, and once again, no cost to you. And we work with multiple carriers, all the carriers in Wisconsin, and on a national scale, multiple different carriers. So the Affordable Care Act plans, they must cover pre-existing conditions. We don't need to ask any health conditions. We do need to get a list of medications because not all plans cover certain medications. Also, ACA plans must cover preventative care 100% prior to the deductible. And as I mentioned, they all work with certain hospital groups. Also, emergency care. All plans cover you in and out of network for emergency care thanks to the No Surprise Act. You can read about it here, and it's great for the consumers. There's no more gotcha on the back end side. And then also, we have put together a video on how to use our quoting, some tools and tips, and that's available in here as well. Also, in 2023 and coming into 2024, many of the ACA plans, based on where you live, are now offering a $0 deductible copay plan. So there is no deductible, but you have copays for services. Those copays all go towards the maximum out of pocket. And in 2024, yes, the maximum out of pockets have gone up to $9,450 for individuals, $18,900 for families. Keep an eye out for these new plans. So it's a great little way to have a $0 deductible where you just pay copays. So we're here to help you through the process. Check us out online. We have over 500 Google reviews. You can follow us on Facebook, LinkedIn, YouTube. And then here is our entire team. This document will be fully downloadable within the YouTube video and also online. So we thank you so much. If you have any questions, call or text our team. We're here to help. A lot of us will be working overtime into the 2024 open enrollment, which starts November 1st. We're here to help. Thanks so much.